I'm Fola Laoye, chairman of HYGEA, which is an integrated health group in Nigeria, working with the Health Insurance Fund to deliver health insurance to low-income groups in the country. HYGEA was formed almost 30 years ago by my parents, who are both physicians, who also had their careers in the public sector and in public health. Then, after they retired, went into the private sector, but still very much having the motivation and the commitment to helping to deliver public health services. We are able, at least in the work we're doing and with the partners that we have, to look at the very difficult issues of delivering public health services, but from a private perspective, which is quite unique and quite innovative. But in so doing, helping to bridge the gap between affordability, what people can afford, and what is the cost of healthcare. I think for me, one, growing up around the business and also where we got to, I did realize that there was a model to be sustained, that could be built and could be sustained and could be taken to scale. And I often think that in the private sector, we are able to sometimes be a bit more nimble and a bit more proactive in terms of looking at innovative ways to solve problems. Nigeria is a country that has large population and very poor health indicators, so that in itself is a problem. But going beyond that, also trying to build a health system for a country that's very disparate, that has many different cultures, very, geographically disparate, is quite difficult. But particularly made more difficult because of challenges of infrastructure, of human resources, of real capacity. And that's something that, health, needs to really be successful and viable. We do want to see stronger political will, one with a government putting a better financing structure for healthcare on the table. We are still severely underfinanced as a sector, but even apart from the financing, the regulatory side of it still needs a lot of work, needs a lot of commitment, needs a lot of capacity. And, and especially if the private sector is going to play a bigger role, it's very important, again, that there's a regulatory framework that governs what the private sector is doing. So, yes, it's an area that, is still nascent. And I, for one, I'm very hopeful that this current government will do a lot more. One important area is what is the cost of healthcare. So yeah, it may sound more quantitative than qualitative, but in a way it's linked because that also really gets us to understand what are the disease prevalences we're dealing with now. We all have heard and seen the numbers globally and even Pan-African for the incidence of non-communicable diseases and what that impact is on health systems. But I don't think we have done enough work and gathered enough data in Nigeria to be able to really holistically say, this is what it's going to cost and how do we tackle that. The work we've been doing with the Health Insurance Fund has actually almost brought that even more to the fore than we had thought it would.